A derecho hit northern Minnesota on June 21st, bringing hurricane-force winds to Bemidji and nearby areas. No serious injuries were reported, but the storm did result in some damage at Sanford Bemidji Medical Center, and we'll hear how the community rallied to get it back online. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm your host, Tim Nelson, and I'm joined today by Karla Eischens, President and CEO at Sanford Bemidji. She says the hospital has been a lifeline in emergencies like the COVID pandemic, and the community returned the favor when the record-breaking storm struck in late June.
We had a storm come through with winds over 100 miles an hour, and on our campus, we were in a tornado warning, so we had got everybody in safe places. As the wind came through, everybody was fine, but coming out of it, there was just a ton of destruction in the region. For us at Sanford, we had some roofs that were ruined. Lots of water just pushed in doors and broke doors. We lost electricity, which is a big component of the next few hours and our response plan. And then really the biggest item, since it really affected our region, our employees and the people that needed to come take care of patients had a very hard time getting out of their locations to get to work.
So, Karla, there's a couple things here that I heard. One of them is the loss of power. I know hospitals have electrical backups, but obviously you can't afford to back up an entire electrical system. So talk to me a little bit about that challenge.
We have backup for very emergent items, and certainly at the medical center, but the other buildings like clinics, they did not have power. For example, on Saturday, then we had a walk-in clinic and a pharmacy that needed to open, and that clinic did not have power. So we had to relocate them.
So you have power for emergency needs and those kind of things. I saw one of the things that you had to compensate for was food service. Obviously, that's important for both patients and staff. And it sounds like people really rallied to help you there.
We certainly have power to make meals for our patients, but a little bit more limited. And our cafeteria also services a lot of our employees. So between that and just the availability of employees, we were really only able to focus on our patients. Kind of quickly, we realized, whoa, a lot of people need food. There are no restaurants open. Grocery stores were closed. So we made a quick call to the United Way, and we have grills at the hospital here. We have picnics. We pulled out the grills, asked United Way if they could get people to come grill burgers for our employees, and like within 2 hours, we had people out there flipping burgers for quite a while. They made up a whole bunch of burgers for people as they came and went. Maybe they need to grab an extra one for their family. So that was just a quick response. We didn't even have to think about it. We were doing the other stuff while the United Way supported that.
So the other thing you mentioned was it was difficult to get staff in. Tell me, you had to make some extraordinary efforts to get folks into work over the weekend.
Yes. So there was an extraordinary amount of trees down all over. So very difficult for the majority of employees to get out of their homes to work. And right away, we identified that we needed to get our teams here so that we could accept patients for trauma. And so that first one would be our surgeon who was on call, who had many trees between him and the hospital. So one of our vice president's husband does a lot of tree work. So he took his daughter and they went out with a skid steer and some other equipment and really got a path to his driveway. He walked out his driveway and they were able to get him to the hospital.
And I know you said that you had limited power backup, and one of the issues you had was HVAC, and you called in some help on that as well, right?
We had a lot of support. Our team came in, and as buildings were coming up or as things were changing, just making sure that we could manage temperatures. We at one point worked with the Northwest Emergency Management Coalition to get another generator here. Luckily, we didn't have to use the generator, but lots of help getting it here, and we had it as backup. We're ready to support it for a nursing home that needed it. So that was an important part of just keeping our patients safe. We had a lot of people, leaders, but other people calling from around, they were out, it was a weekend, so they went somewhere, maybe, down by the cities or to Fargo or somewhere, and they were calling in. We had one of our leaders stop and buy just a whole pallet of box fans on their way back here. I think it was from Costco, and we use those just for moving air in areas that were getting a little more stuffy. And then we were able to share those when we were at a better place with our community. The other part was we really worked hard to put together a seamless way for our employees who need assistance. And by assistance, it could be anything from just basic food to a place to live to tree removal. Kind of started out with our employees, like, we need food. And then second day was showers. And then now we're really full on how do we support our employees, which I'll talk about in a minute. But at one point, then we had a team come from Alexandria, and they just cooked supper for our employees. And again, as this kind of went on, just the need for food was a little bit greater, so they could take food home to their families or whatever they needed. Anything like that, we have a QR code and a phone number. And the United Way's helped us just bring all of the resources together in one place for our employees, and we can help them find what they need. We also have an employee crisis fund, and it's made for times like this where our employees can put their information in to get some financial funding to support whatever they're going through during this time. Obviously, the other part of that is a lot of our employees are the ones that donate to the crisis fund. So just reaching out, does anybody, want to support other employees in that manner?
As important as hospitals are to a community, the community really rallied for you after the storm, didn't they?
Oh, we had all kinds of people. It was, you don't want to have to, but it was great to see our county and our city. The Red Cross came, the United Way, I've already mentioned them, but we just had a lot of support. We had a lot of communication back and forth of our needs, their needs, and really collaborating on how we get through the storm. Obviously, there's still a lot of cleanup and stuff to do, but in those first 3 days, there was just a lot of ways we could support each other.
So I'd be remiss if I didn't ask here what the human impact was and what kind of injuries and other impacts the community was bringing to your medical center.
Yes. So immediately we expected significant injuries, but the storm itself, we really did not see that. We've seen some expected injuries, physical injuries based on tree removal, etc. The other piece is really that behavioral health, that just how we manage such a significant impact on our lives. So being anxious, trying to figure out how to get a hold of your insurance adjuster, and just all of those things associated with an incident like this. And when I mentioned before getting resources for our staff, that's part of it. But then also the community's been reaching out and asking us for support, our behavioral health team, and how they can meet the community with its needs.
And the last question here doesn't often happen, but do you have any words of wisdom for any other hospitals that really get hit by a hurricane in the middle of summer?
It was very good to understand quickly. It's not just about us getting back on track, but people have their own stuff at home. So maybe just taking time, I think taking breaks, making sure people have some time away to figure out their personal stuff was probably the most learning item that I had from this situation.
Well, congratulations on weathering the storm, and I hope that other hospitals are as lucky with their community response when they face challenges like this.
Yes, thank you.
That again was Karla Eischens, President and CEO at Sanford Bemidji. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.